I think it's too often that in medicine and everything else, when we have a test, we almost forget why we do it. And so in this video, we're going to be answering the question, well, why do we do the Pap smear? Why do we do the Pap test? In the early 1900s, cervical cancer was one of the leading causes of cancer among women in the United States and the world. Approximately 40,000 women lost their lives per year in this time in the United States. Enter Dr. Georgios Papanicolaou. With his help and development of the Pap smear, we have decreased that number from 40,000 to 4,000 deaths per year, and hopefully we continue to decrease that number year after year and continue to save women's lives. I'm hoping in this video and other videos we can familiarize ourselves with the different terminology and the knowledge, and hopefully feel like less of a barrier to get these life-saving tests. It matters where you get your information. My name is Eric Schmidt. I'm a board-certified OBGYN and minimally invasive gynecologic surgeon. If you are new, welcome. We are starting a series on cervical cancer screening and HPV. We have a lot to go through. There are so many misconceptions, so many myths in regarding to these topics. If you have any, please write them down in the comments. It'll help us get to some of the questions that are out there. We're going to start with a little bit of history. I don't always love when a certain instrument or procedure or thing is named after its discoverer. However, when it comes to the Pap test, I certainly am okay with Dr. Georgios Papanicolaou carrying its name. As a Greek immigrant, he immigrated to the United States in the early 1900s and then developed what we know as the Pap test and first started to make these discoveries in the early 1920s. He found that sampling the cervix and looking at it under microscope could help discover these abnormalities in these cells that lead to cervical cancer in the future. However, unfortunately, a lot of his papers were initially rejected due to imperfect English and the scientific community not accepting his work. And it wasn't until the 1960s or 70s where the Pap test was routinely done. And over this time, since then, we've been able to decrease cervical cancer deaths by over 70%. However, we still have a lot of work to do. A majority of those cervical cancer deaths, approximately 90% of them worldwide, come from areas where resources are low, where they might not have the resources to screen and treat women with cervical cancer. Even in the United States, there are serious racial, socioeconomic, and even geographical disparities in certain populations that may have them increased risk for cervical cancer, and often this is related to access to care. So hopefully all of that helps us to understand why we do cervical cancer screening or the Pap test. I also want to take a moment to talk about certain risk factors that can lead to cervical cancer. Now, a lot of these are the book answers, and so I'm going to help to kind of show you what's actually important in them. But the biggest, by far, risk factor for developing cervical cancer is HPV. We are going to talk about HPV extensively in its own episode, so stay tuned for that one. However, we'll briefly go over it. HPV is a virus. It is transmitted through sexual contact, or at least the ones that infect the cervix. It's transmitted through sexual contact. Most all sexually active adults will encounter HPV at some point in their life. This number potentially is up to 90% of men and women. One other risk factor that the book will tell you is that those who have an earlier sexual debut or are younger at the first time they have sex also have an increased risk for cervical cancer. However, I would not hold this with too much weight. It's just basically saying potential more exposure to HPV along with multiple sexual partners. Now, again, this is likely just related to the fact that someone has a little more exposure to HPV. Now, a healthy immune system also plays a big role in whether or not somebody potentially develops changes in their cervix leading to cervical cancer. So patients who have immunosuppressed state or are taking medications that might suppress their immune system, for example, people who have had a history of an organ transplant, they may have a higher chance of developing cervical cancer, and so we screen them differently, actually. Same with patients with HIV. We screen them differently because with HIV, you may have a depressed immune system. So someone smoking tobacco is a huge risk factor and something that can be modifiable or that we can hopefully change, because if someone quits smoking, they'll decrease their chances of developing the changes in the cervix leading to cervical cancer by twofold. And lastly, we'll say is that someone who has not had their proper cervical cancer screening or never had it done is going to exponentially increase their potential risk of cervical cancer going forward. So there are a few points I really want to drive home for why we do the Pap smear, aka cervical cancer screening. Cervical cancer is still in the world the fourth most common female cancer. Mainly, this is a result of limited access to care. And so with the Pap smear, we are trying to prevent cervical cancer. In its current form of doing the Pap smear, which is a pelvic exam in the office, most often with a speculum, looking into the vagina and then brushing the cervix, it's a very delicate exam. It can have a lot of anxiety or fear or potential pain surrounding it. And so we do not take that lightly. And I'm hoping in the next episode, we'll discuss potential ways to make that first exam a little better, or ways to potentially decrease pain with the exam, and in talking with your provider, trying to do those things. And my hope is that having these open discussion, knowing that your doctors or provider is willing to work with you, may help somebody overcome that barrier and to seek care to these potential life-saving tests. I think another point too that I'm going to talk about a lot in the future is that if someone has HPV, or if someone has these early changes in the cervix that lead to that could lead to cervical cancer, it takes many years to do that. It's not a fast developing cancer. And so as long as someone is seeking this care and getting their Pap test done, this isn't a cancer that all of a sudden sneaks up on us. And lastly, my last take-home point would be keep a healthy immune system, whether that's diet, exercise, being good to your body. You know, these things are going to help your body to resolve the HPV sooner, because it can be a stubborn virus. It can be there for years. So hopefully these things can help your immune system get rid of the virus even sooner. I really look forward to the future episodes where we're going to talk about, again, things like your first exam, how to make it better, how to decrease the pain during the exam and the anxiety around the exam, HPV and its prevention, and including the vaccine, and current recommendations for screening, or basically what I'm saying is how far apart do we do the Pap smear or the Pap test or the HPV testing, and then how do we manage the abnormal results. All right, everyone. Thank you so much for watching and viewing. It was a little bit of a struggle for me to get through this because I've been out of practice. There's a lot of things happening in life right now. Some things very good, you know, this. Also some things not so great. And so thank you for tuning along. And it's fun to get back in it, but there's a little bit of a, how do I say it? A little rusty getting back in front of the camera. All right, everyone. Have a good day. We'll talk to you soon. Risk of the blah.